What if I told you that 1 in 3 people watching this video right now has a potentially dangerous condition, and most don't even know it? I'm talking about fatty liver disease, the silent epidemic affecting over 2.5 billion people worldwide. Here's the scariest part. It's completely reversible if caught early, but deadly if ignored. What I'm about to share could literally save your life. Hey everyone, I'm here to break down complex health topics into digestible, science-backed information you can actually use. Today, we're diving deep into fatty liver disease, what it is, who's at risk, and, most importantly, how you can reverse it naturally. But first, look around your family, friends, coworkers. Statistically, about 30% of them have this condition. That's not me trying to scare you. That's reality. So what exactly is fatty liver disease? Picture your liver as your body's ultimate multitasking machine. It processes everything you eat and drink, detoxifies. Your blood produces proteins and stores energy. Now imagine that machine getting clogged up with fat. When we eat more calories than our body can process, especially from sugars and refined carbs, our liver starts storing the excess as fat. A little fat in the liver is normal, about 5 to 10% of the liver's weight. But when fat makes up more than 10%, we officially call it fatty liver disease. There are two main types: alcoholic fatty liver disease from excessive alcohol and non-alcoholic fatty liver disease, NAFLD, which we'll focus on today. Here's what's really concerning. Your liver can be 30% fat and you'd feel absolutely fine. No pain, no obvious symptoms. It's called the silent killer for a reason. Let's talk numbers because they're honestly shocking. Recent studies show fatty liver disease affects approximately 38% of the global population. That's nearly 3 billion people. Between 1990 and 2019, global NAFLD prevalence increased by over 50%. And it's not just affecting older adults anymore. We're seeing fatty liver disease in teenagers, even children as young as 10. Among people with type 2 diabetes, between 55 to 70% have fatty liver disease. Among obese individuals, it's over 80%. We're looking at what researchers call a silent pandemic. So why is this happening? The answer lies in our modern lifestyle, and it's more complex than just eating too much. First, sugar, specifically fructose. When you eat table sugar or high fructose corn syrup, your liver is the only organ that can process fructose. Unlike glucose, fructose gets converted directly into fat in your liver. That innocent granola bar could have 20 grams of sugar. Your healthy fruit smoothie? Maybe 40 to 50 grams. But it's not just sugar. Ultra-processed foods, trans fats, and refined carbohydrates cause insulin resistance, meaning your body needs more insulin to process the same food. High insulin levels signal your liver to store fat. Then there's our sedentary lifestyle. Our ancestors moved constantly, hunting, gathering, walking miles daily. We sit at desks for 8 to 10 hours, then cars, then couches. Without movement, our bodies don't efficiently burn consumed energy. Sleep deprivation is another hidden culprit. Poor sleep disrupts hormones like leptin and ghrelin, controlling hunger and satiety. It also increases cortisol, promoting fat storage, specifically around the liver. Here's what terrifies me about fatty liver disease. It's a master of disguise. Most people feel completely fine in early stages. You might have fatigue, maybe some right-side abdominal discomfort, but nothing screaming liver problems. But inside, there's dangerous progression happening. It starts with simple fatty liver, just fat accumulation. Then, in about 20% of people, it progresses to NASH, non-alcoholic steatohepatitis. That's when inflammation kicks in. From there, about 20% develop fibrosis, scar tissue formation. Eventually, this can progress to cirrhosis, extensive scarring severely impairing liver function. The final stage, liver cancer. Hepatocellular carcinoma rates are rising globally, largely due to fatty liver progression. But fatty liver doesn't just affect your liver. It significantly increases cardiovascular disease risk by 70%, which is actually the leading cause of death in fatty liver patients. It also increases diabetes risk by 60%. But here's incredible news. Fatty liver disease is one of the most reversible conditions we know. Recent research from the University of Missouri showed participants following specific diet and exercise programs for 10 months dramatically improved liver health. Another Penn State study found exercise training was 3.5 times more likely to achieve treatment response compared to standard clinical care, even independent of weight loss. Let's get practical. What should you eat to reverse fatty liver? Science-backed strategies that actually work. First, eliminate or drastically reduce added sugars, especially fructose. Read labels obsessively. Look for high fructose corn syrup, agave nectar, fruit juice concentrates. Embrace the Mediterranean diet approach. Multiple studies show this eating pattern can reduce liver fat by 20 to 40%. We're talking olive oil, fatty fish, nuts, seeds, vegetables. Increase protein intake to 25 to 30% of calories from high-quality sources. Protein has the highest thermic effect. Your body burns more calories digesting it. Try intermittent fasting. Studies show 16 to 8 intermittent fasting can reduce liver fat by up to 13% in just 12 weeks. Include specific liver-supporting foods. Coffee, 2 to 3 cups daily, can reduce liver fibrosis risk. Green tea. Catechins are powerful liver protectors. Fatty fish like salmon. Omega-3s reduce inflammation. Cruciferous vegetables like broccoli. Turmeric. Curcumin is anti-inflammatory. Meal timing matters too. Eating your largest meal earlier and lighter dinner can improve liver metabolism. Now exercise. And I'm not telling you to run marathons. Recent research shows you don't need extreme exercise to heal your liver. High-intensity interval training is incredibly effective. Just 20 to 30 minutes, 3 times weekly, can significantly reduce liver fat. We're talking alternating between high-intensity bursts and recovery. Resistance training might be even more important. Building muscle increases your body's ability to process glucose and improves insulin sensitivity. Even bodyweight exercises 2 to 3 times weekly make huge differences. Walking is underrated but powerful. A brisk 30-minute walk daily can reduce liver fat by 10% in just 3 months. One study showed people exercising regularly had 70% lower risk of advanced liver disease, even without weight loss. Let's talk medical interventions. The FDA recently approved the first medication for fatty liver disease, resmetirom for people with NASH and moderate liver scarring. But this should always combine with diet and exercise, never replace them. When should you see a doctor? If you have risk factors like obesity, type 2 diabetes, metabolic syndrome, or family history, get tested. Tests are simple. Blood tests for liver enzymes and potentially ultrasound. Warning signs: persistent fatigue, right upper abdominal pain, unexplained weight loss, yellowing skin or eyes, dark urine. But remember, most people have no symptoms, so regular screening is crucial if you're at risk. Let me share inspiring numbers from recent studies. People following comprehensive lifestyle interventions achieved 30 to 40% reduction in liver fat within 6 months, complete resolution of fatty liver in 25% of participants, significant insulin sensitivity improvement within 12 weeks, 50% reduction in inflammation markers. Your liver is incredibly resilient. It's one of few organs that can completely regenerate. Even years of fatty liver can show measurable improvements within weeks of changes. Here's your fatty liver recovery roadmap. Week 1 to 2. Eliminate obvious sugar sources, sodas, candy, processed snacks. Start reading food labels obsessively. Week 3 to 4. Implement 16 to 8 intermittent fasting. Eat within 8-hour window, fast 16 hours. Week 5 to 6. Add 20 minutes daily movement. Walking, bodyweight exercises. Week 7 to 8. Incorporate liver supporting foods daily. Coffee, green tea, fatty fish. Month 2. Add resistance training 2 to 3 times weekly. Month 3. Get retested to measure progress. Key is gradual implementation. Don't change everything overnight. That's failure recipe. If this video opened your eyes to fatty liver reality, do 3 things. First, if you have risk factors, get tested. Knowledge is power. Early detection saves lives. Second, start implementing changes today. Don't wait for the perfect moment. There isn't one. Pick one thing from this video and start today. Third, share this information. People you care about need to know about this silent epidemic. Someone watching has fatty liver and doesn't know it. If this provided value, smash that like button and subscribe for more evidence-based health content. Comment below which tip you're implementing first. Remember, your liver is incredibly forgiving and resilient. It's never too late to start taking care of it. You've got this!